The United States is to provide 500 million doses of vaccine to developing countries. The Delta variant continues its deadly march, and what will a post-pandemic recovery look like? Hello, I'm Arnold Naidu, and this is The Heat. Here in the United States, more than 300 million COVID-19 vaccine doses have been administered, but the country is unlikely to meet President Biden's goal of 70% vaccinated by July 4th. Africa still needs 225 million vaccine doses to hit a 10% inoculation target, and countries like India continue to wrestle with the deadly Delta variant. For the latest in India, I spoke earlier with public health activist Achal Prabhala. Achal, thanks so much for joining us.
Thank you, Anna. Thanks for having me.
The last time you were on the show, which was about a month ago, you described the situation in India as hellish. Has that situation improved?
The situation's definitely improved, Anna. The number of cases has gone down. The death rate, the mortality has gone down as well. The worry here is whether cases have gone down substantially because of lower transmission or merely as a result of lower testing. There's a perennial question as to whether the mortality is being accurately measured, either in our worst phase 2 months ago or now. So it's, I think, safe to say that it's better than it was. It's not clear, however, how much better it is or whether we're out of the woods as yet.
Well, let's talk about the Delta variant. That has been responsible for driving the second wave in India. And doctors are also reporting some very unusual symptoms like hearing impairment, severe gastric issues, blood clots, which in some instances have led to gangrene. What can you tell us about the impact this variant is having on the pandemic in India?
There's a little more research coming out now, especially in terms of its links to vaccination. There is more research that's come out of the United Kingdom because there's better monitoring of the Delta variant there at an earlier stage than it was monitored here in India. What we know is that it is definitely more transmissible than the original COVID strain, and that it is possible that with one dose of either Covaxin or the AstraZeneca vaccine, which are the two vaccines in circulation in this country, that there is lower protection against infection and transmission of the virus. This improves a little bit with the second dose. 2 doses of either of the two vaccines circulating here do seem to provide a good amount of protection. Of course, we have very few people who have received both those doses. And we do know that there is protection against severe symptoms or hospitalization as well, which is adequate after a second dose of either of the two vaccines circulating here. But that's one of the problems, because there are very few. In fact, as little as under 4% of this population has been inoculated with both doses of either vaccine.
And these unusual symptoms that I mentioned, have you heard anything about them?
I have to say that there is a lot of speculation that is circulating, I think some of which is purely anecdotal. It's, I think, something that we are still awaiting better medical information on. I don't know of any conclusive study that shows that there are a set of special symptoms or conditions that are associated specifically with the Delta variant.
So if we look at the situation in India right now, the country has just reported 6,100 deaths, more than 6,100 in just one day. That's the highest daily toll in the world. Later this month, the government says it will start offering free vaccinations to all adults. Up to now, it's been adults 45 and over who are eligible for the vaccine, but now it'll be offered to all adults. How big a change would that be?
This is a very, very confusing situation. And what's confusing about it is the different waves in which vaccination was announced in this country. So we started in January with vaccinations that were limited to healthcare workers. That expanded a month and a half later in March to include people above 65. It then very quickly, in the space of a couple of months, expanded to include everybody above the age of 18. So this, in fact, this expansion of our vaccination program happened quite a while ago. The problem was that we didn't have anything close to the number of vaccines that we needed when the government announced an expansion that would include 945 million people, or nearly something that would require 2 billion doses of vaccines when we had less than 100 million on hand. What that resulted in further was a rollback of the vaccinations for people above 18. It was then further informally restricted to people above 45. I know this myself because I received a first dose of the vaccine. I'm above 45. And my second dose was then pushed out from what was earlier the guidance of between 6 and 8 weeks for the AstraZeneca vaccine, has now been pushed out to 12 weeks, which is, it's still within the permissible range, which means that it's perfectly fine to be taking the second dose at that time, but it's not a purely epidemiological decision. It was a decision that was made on the basis of an acute shortage of vaccines, which has not yet ceased. We still have a shortage of vaccines. What has further complicated the situation is a very confused rollout of the vaccines over the last few months. So you had a way by which the central government could buy vaccines and then send them to states. You had states that were allowed to buy their own vaccines from overseas if they wished to. You had private companies who were also able to negotiate the same vaccines that the state was buying, but at much higher rates.
Right.
You had dozens of entities who were all competing for a very small pool of vaccines, but at completely different rates. And it was extremely confusing. And what it led to is basically a very unequal rollout of the vaccines, which I think you still see today, where to the extent that you have the money to pay a little more for a vaccine at a private hospital, or you're lucky enough to be employed at a private company that's vaccinating its employees, you get access. If you're a public citizen who wants to get a vaccine at a public health center, it's much harder.
Yeah, talking about an unequal rollout, there's also a very big gender imbalance. I mean, the numbers show that far more men in India, 17% more than women, have been fully vaccinated. Why that gap?
That's a really shocking statistic. I think that it speaks to the gender imbalance in this country, which is something that has been longstanding, that we know fully well exists. It could perhaps be linked to the gender imbalance in formal employment, which means that to the greater extent that men have a formal employment through which they're being vaccinated, that same facility is not being afforded to women because they're not represented as much in formal employment. It will be because of the long-standing gender imbalance in this country in terms of how families work, how societies work. And what is true, however, is that it is something that's inexcusable and really shocking that I think the state must work actively to correct. Look, I think it mirrors imbalances elsewhere in the world. The rates at which white Americans have been vaccinated is very different from the rates at which Black and Hispanic Americans have been. So this is not the only imbalance I think that exists in the world, but the way to address those imbalances is to run programs specifically to target those who are eligible to get vaccinated and are not.
Right. What about getting vaccines to the more remote parts of India, rural areas especially?
We have a problem here in India, which is the same, which is a problem that I think has manifested brutally during the last 2 months in the worst phase of the pandemic, where access to healthcare was in peril the further you lived from a city. I think that the failure of the health system in general to address everybody, especially people who live outside densely populated urban areas, was something that manifested very, very clearly. Unfortunately, I think that same failure of the healthcare system to reach people in not so remote rural areas, as well as to reach people who are not at the top tier of the economy in urban areas, is something that is continuing into the vaccination drive, because it's the same facilities that are finally going to be used to deliver vaccines, and they're inadequately equipped at the moment to do so.
Achal, we just have a little bit of time left, but I want to get back to an interview that you did with the US network recently. And in that interview, you said that the Western-led pandemic response has failed to, quote, address the needs of 85% of the world. How so?
15% of the world, roughly, Anand, lives in the richest countries on earth. The richest countries on earth made sure that the Western pharmaceutical companies located in their borders produced vaccines only for their countries and for absolutely no one else. So you take a vaccine like Moderna, for instance, it's almost non-existent outside Western Europe and Japan and other rich countries like Australia and the United Arab Emirates. Pfizer has a slightly greater footprint outside that 15%, but otherwise too is primarily concentrated there. And so the failure of these companies and these countries is in stark contrast to vaccines from, let's say, China or Russia, or even India and Cuba, which have served a far greater part of the world, the middle-income countries, which constitute about 30% of the world, and poor countries, which are about 50% of the world.
Right. Okay, we are going to have to leave it there. Achal, thanks so much for being with us.
Thank you. Thanks very much, Anand.
There is still much to talk about. Let's get to our panel. Cesar Carcamo is an epidemiologist at the Cayetano Heredia University Hospital in Lima, Peru. John Quelch is Dean of the University of Miami's Business School, and we're also joined by scientist, entrepreneur, and philanthropist William Haseltine. He heads Access Health International. Thank you, everyone, for being with us. And Bill Haseltine, you actually wrote the book on variants, so let's start there. As we just heard, India is in the grip of the Delta variant. An epidemiologist in the UK says it is 60% more transmissible than the Alpha variant. What can you tell us about this variant, and what are the risks that it poses as the whole world tries to overcome this pandemic?
Well, thank you for asking and mentioning the book, but the primary risk is that it will infect people who've already been infected. It seems very capable of that in India. That it is far more transmissible. Let me just give you a number to think about. If the Wuhan strain was 1, the European strain that swept the entire world is 2 in terms of transmissibility. The virus that displaced that in the UK, called Alpha, is 4 on the scale, and this is probably 8. So 8 times more infectious. That's really dangerous. Not only is it more dangerous in terms of transmissibility, it seems to be able to do many things better than the other virus. All the viruses could suppress your immune system. They're masters of disguise, deception, masquerades. These are very clever viruses. And when you look at how they do that, they change almost every part of themselves to become worse for us. Better for them, they get around better, but much worse for us. So this is very serious. And the $64,000 question is, how well will our vaccines protect them? Some of the vaccines do a very poor job, virtually non-existent job, I might say. And many of the others do a reasonably good job for some time, but how long they'll last, we don't know. So these are serious issues to consider. When people are beginning to relax, they think, at least in the United States, that COVID is on its way out. And at any moment, we could get hit by this or yet another variant. So it's serious what's happening. And all you have to do is look at India and look at the UK today, where this variant has almost completely displaced the problem variants they had before.
Bill, just to be clear on something you said at the beginning, you said the Delta variant can infect people who've already been infected. Are these people who've been infected and recovered, or do they get attacked a second time?
They get attacked a second time, and many of them get sick. You know, the idea that being infected once is enough, you could ask the people in Manaus if that's true. You know, when you look at how many people were infected the first time in India by the strains they had then, some people think it was up to 50% or more. And many of those same people have been reinfected, and many of them are getting sick and dying, both in Brazil with their strain and India with their strains. So we have to do better with vaccines, and fortunately, vaccines are doing better in protecting us because most of the virus tricks that it has aren't there for the vaccines. You get a much better immune response. with vaccines, and especially with the Moderna and the Pfizer vaccines, than you do from natural infection.
Cesar, let's talk about Latin America and look at Peru. Peru is among the hardest hit countries in Latin America. In fact, the government there has tripled its official COVID death toll to nearly 181,000, which actually makes the country makes Peru the country with the worst per capita death rate. It's also raised huge concerns about government credibility. This is one resident in Peru talking about this. This is what she had to say. Let's listen.
I don't know if the government lies to us or tells the truth. We have that problem. There are dead being taken out of the hospital every day. They go into hospital every day, and we don't know. Relatives wake up here in the cold, and sometimes we don't get the full report. That's the truth.
So, Cesar, what do you see as the government's failure in dealing with this?
We have a health system that is been very weak for decades. It's not something recent. There has not been much investment in health. And we even have a law that restricted the access to oxygen. So that is really what is going on. Patients go to the hospital, many of them die. Many cannot get a bed and die at home. But the numbers that we are having nowadays for Peru are actually not comparable because of different case definitions to the numbers that other countries in the region or in the world report. That's nowadays we are using a different case definition.
But doesn't this put a huge question mark over the credibility of what the government is trying to do and what they're telling people there?
Yes, that is true, but it's internal credibility versus worldwide credibility. So very early in the epidemic, newspapers started counting deaths at funeral homes, funeral companies, and they found that the numbers, adding up the numbers that they have been cremated, were much higher than the ones reported by the government. And the difference is because the government was originally reporting only confirmed cases with a positive test. And at the funeral companies, they were counting all cases with confirmed or suspected COVID. And that number is much bigger. So from there, the government lost trust from the people, and that problem became worse and worse. We even had a new president, and I think this is a way of trying to show people that they are not having anything. So the new counts include cases that whose death certificate says there is a suspicion of COVID, cases that die in close contact with other persons with COVID. So if the epidemiologist or the physician or anyone suspects COVID, that person is counted as COVID. And this is not what is happening in neighboring countries.
John Quelch, let's look at the huge struggle, the balancing act that leaders and governments around the world are engaged in, and that is trying to overcome the pandemic while they're also trying to reopen their economies. I mean, people are looking very closely at which economies will bounce back. China has bounced back into a recovery. In the United States, Moody's and CNN report that the economy here is back to 90% of its pre-pandemic levels. But of course, much has changed. People have been working from home for the last year. The hospitality industry has changed as well. In fact, they're struggling now to find workers in that particular sector of the economy. What will the economy look like post-COVID?
The rebound has been extremely strong, perhaps stronger than expected in the US. And as you said, China has rebounded strongly. That is partly due to the fact that they took very strenuous action to put a lid on the virus as soon as it started spreading. In addition, China has done a good job of restoring its supply chains for exports to the West, thereby diminishing any risk of markets and supply chains being relocated to Vietnam and India in any substantial way. And the Indian story actually reveals one of the challenges associated with supply chain relocation. If companies had relocated from China to India, they would now, of course, be very concerned about that decision. So global pandemic, you have to, I think, be concerned about the complacency that Professor Haseltine referred to. This is a moving target. The variants are going to continue, and we have to be vigilant. I think complacency is perhaps one of the biggest threats to success from an economic point of view in the months ahead. And it's worth noting, finally, that all emerging economies that have these fragile health systems that have been subject to underreporting, all of these economies are going to do worse economically than they would have been expected to do before COVID. And the reduction in performance is going to be greater for the emerging economies than it is for the developed countries that have vaccine production within their borders and which have health systems that can deliver, as we've seen in the US, 65% of the population at least partially vaccinated, the adult population to this date. So let's be wary of complacency. That is the key message, I think, for economists as well as epidemiologists.
Bill Haseltine, there have been some other developments on the vaccine front. Moderna, the pharmaceutical company, is seeking approval for its vaccines to be given to adolescents aged between 12 and 17. And President Biden, in fact, has just announced that the United States will buy 500 million doses of vaccine, which it will provide to other countries. This is what the president had to say. Let's listen.
The United States will purchase 500 million doses of Pfizer's COVID-19 vaccine to donate to nearly 100 nations that are in dire need in the fight against this pandemic. That's a historic step, the largest single purchase and donation of COVID-19 vaccines by any single country ever.
So, Bill, what kind of impact will this have?
Well, this is fantastic news. What you've heard is just the tip of the iceberg. The United States is beginning to use the full weight of its international power, its domestic power, to help solve the world problem. They're not only doing that, at the G7 right now, they're encouraging the other leaders to do the same. And the most recent news is the 500 million dose donation that was just announced has been matched by the Europeans, who are going to donate another 500 million dose. U.S. leadership really matters in this. Not only will it donate vaccines, it will be donating the best vaccines. Step 2, using its resources and encouraging others to build vaccine manufacturing capabilities throughout the world so that you can make your own vaccines, not only for this, but for others. For example, in the continent of Africa, the continents of South America are dramatically deficient in vaccine production, as there is true in many other parts of the world. That's being addressed. And that isn't all there is to it. The next step of this, and what they're now doing, is what we did with PEPFAR. Most of the world doesn't know that we spent $100 billion or more on treating AIDS for the last 25 years. We are going to be, the U.S. is going to be helping countries build the infrastructure to make sure those shots get into arms, just like we've done making sure that AIDS drugs get to patients with AIDS throughout the world. And we are going to be helping them create those health infrastructures and strengthen them, not only for this pandemic, but for others. And I fully expect that our leadership will help other countries do the same, especially the European countries that are already been encouraged now to be so generous. And I know that one of the things you've been concerned of, and in the interview that started, was vaccine equity. These are big steps, just the first steps, but big steps toward vaccine equity throughout the world.
Right. Cesar, I don't have too much time left, but you've been quoted as saying that nearly every Peruvian knows someone who has died from COVID-19. The border region between Peru and Bolivia is an area of particular concern because of the cross-border traffic there. I mean, what can you tell us about that region and the risks of more infections coming from all this traffic going across the border?
Well, that border is basically open. Then no much control. It's an area that is densely populated. Is susceptible to the disease. At the beginning, we thought that because of the altitude, they were protected because they were the last places where the virus arrived. But the pandemic hit that area of Puno, close to La Paz in Bolivia. The pandemic hit it very hard. So this is an open door for the virus to cross from Peru to Bolivia and vice versa.
John Quelch, one other question which we're hearing about very often these days, and that is fears of inflation. We're hearing that consumer prices in the United States are rising very quickly. Is this related in any way to the COVID pandemic?
Yes, it is to some degree, because first of all, there's supply chain disruption, both inside the boundaries of the economy, but also international supply chain disruption as well. That's particularly affected commodity prices on the international front, commodities especially coming from emerging markets in Latin America and Africa. And then there's also a certain amount of panic where consumers are not so much in the US, but in other countries around the world, including India, for example, where consumers are stocking up in anticipation of shortages and thereby adding to inflationary pressures. So to take India in particular, we would expect to see GDP growth significantly below the 10% that had been previously forecasted for the year, and inflation running maybe 7-9% or thereabouts, again significantly higher. But these numbers, especially the inflation numbers, as we know in the US, the current numbers typically way understate the level of price inflation that you or I actually encounter when we go into the store.
Okay, and we have to leave it there. Thanks to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.